welcome back. In today's video, we are going to discuss polyhydramnios management. So the complications of polyhydramnios and the management part. So complications, again we can divide the complications into two aspects, the maternal complications and the fetal complications. So maternal complication, again you can divide that into three areas of your antenatal period, intranatal period and in the postnatal period. So the antenatal period complications include preeclampsia. So already in the last class we have discussed that the woman will have symptoms of preeclampsia. That is like she will be having increased blood pressure, that is hypertension. She will be having edema all over the body, or otherwise sometimes there is a facial edema, sometimes there is an hemorrhoids, a vulval edema, anything can be present. And sometimes there is also proteinuria, which are all the evidences of preeclampsia. And coming to malpresentation, why malpresentations happen? It is because the woman is having the amniotic fluid level is going to be very high, and because of that you cannot determine the position of the baby. So what happens during labor? You know, during the later weeks of pregnancy, that is during term, the head has to get fixed into the pelvic cavity. But here what happens, as there is an excess amount of fluid, there will not be engagement taking place. And when there is a rupture of membrane, what happens? There may be a cord presentation, shoulder presentation, knee presentation, foot presentation, anything can happen. So there may be malpresentations of the fetus, and there may be premature rupture of the membrane. You already know the uterus is a cavity. It is able to hold only the adequate amount of substances it is supposed to hold. So you know the uterus is capable of holding a 3 to 4 kg of baby, the placenta, amniotic fluid, only whatever it is able to hold. But in case if it is going to be excess, so when there is a polyhydramnia, the capacity is more than the normal, so it can lead to premature rupture of membrane. And there can also be hemorrhage. That is hemorrhage, why it happens? There may be an initiation of labor, so it can happen. So these are the antenatal complications when there is a polyhydramnia. And when we are coming to intranatal complication, you have to see for the delivery of the baby. When we are coming to the delivery of the fetus, there may be a premature delivery of the fetus. So premature delivery happens, that is when the labor process is getting initiated very early, as because the cavity is already full and overloaded, there may be a premature delivery taking place. When we are coming to the area of intranatal complication, the first complication is rupture of membrane, that is premature rupture of membrane. Already I said you, in case if it is happening in the early pregnancy, that is like before the labor process is getting initiated, you say it is premature rupture of membrane. So here also it happens during the intranatal process, rupturing of membrane is taking place, where before the proceeding of the labor taking place, only the rupture of membrane is taking place. That is an intranatal complication. And again prolapse. So when there is a rupturing taking place, when there is the amniotic fluid is coming out, at that time cord can come out. So that is like, first you know the fetal parts have to be delivered, and then comes the placenta, then comes the cord, and then the placenta. But here what happens, when the amniotic membrane is getting ruptured, at that time the cord is getting prolapsed, so the complications are more. What happens, the cord is coming out and there may be an hampered circulation for the fetus, so at that time the fetus can go in for complications. So you have to assess for the prolapse of the cord. And then coming to the operative delivery, so you know like when the labor is going to start, there is already the part is getting engaged and the labor is going to proceed in a sequence. But here what is happening, you already have lot of fluid, and this fluid when it is getting, like when it is coming out, what happens, you don't have a particular part presenting, already the mother is having malpresentation. So what happens, you cannot have a normal labor proceeding, so you have to go in for a forceps delivery, a ventos or a cesarean session. There may be a need, so accordingly you have to plan for that. and then you have to think about retained placenta, as because there is an increased fluid in the abdomen, there may not be an adequate contraction taking place, which may lead to retained placentas. And of course, when there is a retained placenta, you have to remember the next step, that is your PPH, that is like postpartum hemorrhage. So when there is bits of placenta which is remaining inside the uterus, or otherwise when there is an inadequate uterine contraction, you have to think about postpartum hemorrhage. So these are the complications during the intranatal period. And then the complications, what happens in the postnatal period, includes subinvolution. Involution is the normal reverting process from the pregnancy state to the pre-pregnant state. But here what is happening? Sub-involution. So like whatever the process has to take place, it doesn't take place completely because there is polyhydramnios. So everything is going to happen in an abnormal way. So there is a decreased involution process, that is your sub-involution taking place. And most of the time there is bits of placenta remaining, the sub-involution process is taking place, and anything may be the cause. There can be a puerperal sepsis also. Okay, so we will have a detailed discussion on your puerperal sepsis. Just remember, the complication of polyhydramnia is puerperal sepsis. Then coming to the fetal complications, we have two areas of major complication. One is prematurity. So prematurity, already we have seen in the antenatal period, there may be a premature rupture of membrane. So when there is a premature rupture of membrane, the labor gets initiated and the baby is born before the week of gestation, that is before term the labor is taking place. So the baby is small. Either the baby is small for gestation or it is a premature baby taking place. Okay, so you have to remember that is one of the major complications of the fetus, and you have to remember about the anomaly. So already we have discussed, whenever there is an open meninges, you have to think about polyhydramnia. So that is an indication. When there is a polyhydramnia, you are getting an indication that the mother can produce a congenital anomaly baby. When we come to the management of polyhydramnias, you have to remember the early phase of polyhydramnia, that is like where you have to provide care. You have to take the pregnancy to a safe area and land. So that is like you have to hospitalize the mother when she is having complaints of breathing difficulty or palpitations or like edema. All these complaints, when there is complaints like this, like you have to hospitalize the mother, or otherwise provide adequate bed rest for the mother, as she may have she may have breathing difficulty. So you have to give her adequate bed rest, and then you have to assess for the postprandial blood sugar levels, where you have to suspect the mother is having diabetes. So when the mother is having diabetes, the fetus can also have diabetes. So you have to go in for diagnosis of those conditions also, and then you have to go in for ABO grouping and typing. So already we have seen, when we have discussed, we have seen that ABO grouping and typing is important to rule out congenital anomalies. Okay, so you have to see for these areas in the antenatal period. And then when we are coming during the labor process, you have to divide the area into three, that is like when there is a fetal abnormality, and when there is fetal abnormality with the complication and without complication, which is less than 37 weeks and more than 37 weeks. So when there is a fetal abnormality, that is a congenital anomaly. Suppose you think about renal agenesis or anencephaly or a major congenital open spina bifida. In all those conditions, what we have to do is like you have to go in for termination of pregnancy in case if it is an early pregnancy. So you have to go in for artificial membrane or rupture of membrane, and you have to terminate the pregnancy in there is a fetal anomaly, that is when there is an abnormality of the fetus. So in case there is no fetal abnormality and the fetus is normal, you have done an anomaly scan and the baby is fine. So with that, you are proceeding the labor process. So you have two areas, that is when there is when the pregnancy is less than 37 weeks and when it is more than 37 weeks. When it is less than 37 weeks, you can go in for amnio reduction. That is like you are going to decrease the amniotic fluid. That is, you create an artificial opening. That is like you are going to remove the excess amniotic fluid to continue the pregnancy. If the mother is symptomatic, so when the mother is having dyspnea, at that time you can go in for amnio reduction, where the amount of amniotic fluid can be decreased and the pregnancy can be continued till 37 weeks. So in case if it is more than 37 weeks, you need not worry, the baby is also fine and it is even crossed 37 weeks, you can go in for termination of pregnancy. That is like you can proceed with normal labor process. So you have to remember amnio reduction, because like sudden reduction in amniotic fluid can cause lot of complications as prolapse, and like the mother can go in for sudden collapse, and all those things can happen. So always think, before the labor initiation you have to start with amnio reduction, then you have to go in for stabilization. That is like you have to start with the labor process. That is like you can go in for the steps of labor induction, which includes your starting of oxytocin drip and like the other areas, like how you will induce labor. And then you can go in for artificial rupture of membrane, that is controlled artificial rupturing of membrane, where you have to go in for your posterior rupture, and it is a slow rupture where the delivery process gets initiated. So this is with your management of polyhydramnios. Hope you have understood polyhydramnios clearly from the area of definition, the etiological factors, the signs, symptoms, investigations, the complications and management. So in case if you have doubts, kindly comment in the comment box and let me know like where you are having doubts and where you need extra clarification. If you want any particular subjects, kindly comment in the comment box like what topics you want. Thank you and take care. Bye.